CIL 650.
Chew it, 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 baby. Every time you love me, it's a real sugar treat. Chew it, chew it, chew it, chew it.
Chewy, 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 the Ohio players from way back when. You remember that song? I know you do. Don't say you don't. I try to find like teeth songs for Dr. Zokol and Dr. Birdie when they come to visit us, and yeah, that's Chewy, Chewy. But before people come to see you at BC Perio Dental Health and Implant Center, a lot of people can chew.
Oh, it's very true.
Yeah.
Yeah. We had a person come in just the other day, actually, and the poor guy, he's been without teeth for an awful long time. A few snags left over, decay, but hasn't been able to afford to do anything. And he came in because he heard of the complimentary examination. And we found a way to get it done for him.
Nice.
We found a way where he was entitled to some work. The ministry was going to allow him to have certain things done. So although we weren't able to get him to the ideal, we were able to get him to healthy, and now he's scheduled to have that treatment done. But there are people in pain who suffer through it, and the thing that I think want people to remember is that when you're in pain, it means something wrong is happening in there. And if it's a disease process, it just gets worse. So the idea is that if pain is telling you something, go get it checked out. You can do that with us. You go to your own dentist. That doesn't really matter. But do get it checked out.
We had a gentleman call in, I guess, a couple of months ago, and he was talking to you on the show, and he said that he's in pain. And the first thing you said, the first thing out of your mouth was, take care of the pain first.
Absolutely.
Yeah.
Have you ever thought about what it takes to be objective about what's going on in your mouth when you have this pain going on? I don't know how somebody can.
Well, it's hard to do anything.
No, just get the thing out of there. What you really want is get the pain out of there.
Right.
But you'll sacrifice just about everything to get the pain out.
Yeah, no, this is true.
And people will throw away the baby with the bathwater, if you will, just to get rid of the pain. So get rid of the pain first, and then do a proper analysis of what's the proper way to go from there.
We talk about implants, teeth in a day. Let's talk about some of the other things that you do down at BC Perio.
Yeah, for sure. And you got to remember, this is predominantly a periodontal office, and we have high-skilled hygienists in BC Perio who treat and manage people periodontally and do their cleanings and see them on a regular basis to maintain their dental health through proper cleaning and proper oral hygiene instruction, and to help them out. So we have not just the referring patients for the work that Dr. Birdie and I do, but we have a lot of people who come in there for their maintenance on a regular basis as well.
Interesting. I'm just wondering, let's suppose that there's a person listening to the show and they've let their teeth go for a number of years, for whatever the reason, it doesn't matter. And they say, I would like to go and see Dr. Zokol, I'd like to go and see Dr. Birdie, but I'm just a little too embarrassed.
Boy, I think that happens all too often. And when you really think about it, you understand why. Now, from Dr. Birdie's perspective and my perspective, you say, well, that's silly. We're here to help you for that. But really, put yourself in their shoes just a little bit, and you realize that you're bearing your soul, your dental soul, if you will, to somebody who you're not familiar with. And there is that tendency to be embarrassed. And what I want to say to people is, that's what we do. We aren't there to judge you. We're there to help you. So just trust us not to put you in a bad place, and we'll help you get this thing solved.
So you've been doing this long enough that you've seen probably just about everything, and that you're full of empathy for people.
How can you not and do your job properly?
Yeah.
We do things better when we can understand where people are coming from. And if my 40-some-odd years in this business has allowed me to do that more effectively, then so be it.
And you were talking about where people are coming from, and they're coming from all over the place to see you.
All over the world, actually.
Yeah.
Yeah.
Just amazing. Just to get, you told us earlier in the show, but tell us, you got people coming, of course, from Canada, from different parts of BC, but around?
Taiwan. Switzerland. U.S.
But there's still room for us to go, right?
Oh yeah, I mean, my practice is full of international people. It's we see people coming back. There's probably I can think of maybe half a dozen to a dozen, and that come from various distances to be treated, but I mean, that leaves an awful lot of space open for other people, the locals.
Well, you know, Dr. Zokol and Dr. Birdie, of course, are the doctors to the stars. I'm just throwing that in. But they've got athletes, they've got people from Hollywood, but yet, you know what? They've still got you and me, and you have room for us, and that's what we like to talk about. That's what the show is all about. It's the BC Perio Dental Health and Implant Center. There are 2 locations for you to choose from to get expert help with your dental problems. In Vancouver, it's the number 501-777 West Broadway, 501-777 West Broadway, Broadway of Willow. The telephone number for your complimentary consultation, 604-872 0222, 604-872-0222. And if you live out in Coquitlam in the Tri-Cities area, there's only one place for you to go. It's number 250, 1175 Johnson Street. Number 250, 1175 Johnson Street. The telephone number out there, 604-936-8244. 604-936-8244. Did you hear that? I think somebody's calling. Don't call me. Call Dr. Zokol. Call Dr. Birdie. In Vancouver, 604-872-0222. In Coquitlam, 604-936-8244. Dr. Ron Zokol is with us, and I'm so happy to see you. I don't know.
Oh, thank you.
You just make my day. You just make my day. I know that people go to see you. Let's talk about the person that's very, very, because, you know, let's face facts. There are people that are nervous to go to the dentist.
Absolutely.
Mm-hmm.
People have had poor experiences in the past, and that's to be kind about it.
Mm-hmm.
And those fears and those anxieties do not leave easily. And people have to work their butt off to overcome them in order to get their body into an office like ours or any other office for that matter.
I remember the days of going to private school at the younger grades. They would take us off to some sort of clinic on Granville Street. I don't know if you can remember or not. But the guy down there, and I can't remember what the poor gentleman's name was, but he used to just frighten the living bejeebers out of me. Here's the needle. Oh, gee whiz. And, of course, with him pedaling on the thing didn't help. No.
That's old-time dentistry.
That's really old-time dentistry. But you folks over at BC Perio just make it so easy.
We have great technology, and I think we have some very, very, very skilled people in that facility to use that technology to do things which are really advanced.
Mm-hmm.
And many times we don't need the advanced technology, but when you have it and
It's
can
there.
put it there, wow,
Yeah.
I'll tell you, it makes the tough things a lot easier to do.
Well, I remember after the show one day, you and the other good doctor had left, and Dwayne and I, our regular producer, were chatting about you, and he says, I have this impacted wisdom tooth. Do you think Dr. Birdie or Dr. Zokol will look at it? I said, well, why don't you ask them? And he came down to see you guys.
That's right.
Yeah.
Yeah, and we got that impacted wisdom tooth out there fairly efficiently.
And he said it was pretty much impacted.
Yeah, we call that a horizontal impaction. So it's a significant surgery to remove that. You got to remove it in pieces over time, and then you got to rebuild that structure, those areas where the tooth came out.
Let me ask a dumb question. What would happen if he hadn't have gone down to see you and it left that tooth in there? What eventually would have happened?
Well, there was some indication that the infection was getting down alongside the adjacent tooth. So the future isn't absolutely certain, but there was a significant risk that he could have lost both teeth, not
Wow,
only the
really?
impacted tooth, but the tooth he was sitting up against.
And of course, teeth are so important to the rest of your general health.
Oh, for sure.
Yeah.
As Ted Pipping had said, it's a portal to your body, and whatever goes into your body usually goes in through the mouth.
Mm-hmm.
And what you're able to do in terms of chewing it and breaking it down so the body can absorb the nutrients on a more efficient basis is helpful. And if you can eat the right type of foods, that's even better. And those happen to be fibrous and harder to chew. So good teeth is very effective in getting the proper nutrients into your body.
And when it comes to candy, I mean, let's face it, we all have to have a little candy into our life now and then. But a dentist friend of mine told me once it's better to have a sucky candy than a chewy candy.
There's truth to that. Because if it sticks onto tooth structure and stays there, that's how you can get decay. Having said all that, I've always maintained that if you are eating sugar, it's doing the rest of your body a lot more harm than it is your teeth. So if
Really?
you're eating sugar and you're cleaning your teeth, it's not hurting your teeth, it's hurting your body as a whole.
I'm glad you brought that up. Let's talk about cleaning teeth, and we'll do that when we come back. We're speaking this morning with Dr. Ron Zokol, who is one of the lovely people you meet over there at BC Perio Dental Health and Implant Center. They'll take wonderful care of you. There's a complimentary consultation, which means it's absolutely free. And if you've been thinking about it, maybe it's time to make that move and give them a call. The telephone number is 604-872-0222. That's in Vancouver, 604-872-0222. The address is 501-777 West Broadway, Broadway and Willow. Very easy to find, lots of parking. And after that, depending on what you had done, you can go shopping, go to a restaurant,
Lots of business over there.
or watch other people eat. Again, depending on what you had done. Or if you're out in the Coquitlam area, it's 250 1175 Johnson Street. That's number 250 1175 Johnson Street. The number in Coquitlam, 604 936 8244. It's Tom Lucas with Dr. Ron Zokol, and you're listening to Boomer Life. It's all about BC Perio Dental Health and Implant Center.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.